Hi everyone, I'm Dr. Justin Lin here at Rehab Revive Physical Therapy, where we rehab your mind to revive your body. Today, I want to talk about whiplash. Some of you may have just checked out of the ER, everything looked right on x-ray, and you're still feeling cruddy or crappy. You've got headaches, neck aches, you can't turn your head. This is a great exercise that's coming up, so stay tuned. All right, so let's talk about the mechanism of whiplash and why you feel as crappy or cruddy as you do. A lot of times when you've got hit from behind, it's a shock to your body, or you got an airbag that deployed and knocked you in your head. It's almost as if you had a concussion. And like a concussion, all the ligaments, muscles are now running around, like a chicken with their head cut off, things as simple as turning your head. All those big muscles that control and give you rotation or movement are now trying to stabilize you. It's like a neck collar, and you might see that sometimes you're issued a neck collar leaving the emergency room or urgent care. It's just right there, it's all the external stuff, and that's okay, but you need to start working on the stability, the internal neck collar. You got the longest collar, you got the multifidi muscles, you got 5,000 splenius, capitis, all that fun stuff. You can check that out all on Anatomy app. But the most important thing is let's create that internal neck collar, and that's going to be the key because we have an instability issue. We need a stability solution, and that's that stability exercise. We want to mirror that, and you want to create that internal neck collar. So that's what we're going to do with this next exercise coming up. All right, this is cervical stabilization, upper, middle, lower. I like to think of our neck and our head as thirds. So you want to be using either a strap, a belt works, a towel at home. So all these works. Yoga strap is my favorite. And here's the upper. It's generally right behind my head or the base of my skull, right around the ears. Middle is over here, and that is right kind of dead center, a little bit below my scalp line or my hairline. And then you've got the lower, which is at the base of your neck, kind of where my collar is right now. That's going to be the key here, is where you position. So you have these three positions: upper, middle, lower. Upper, middle, lower. That's going to be the key. So the most important thing about upper is that when we set it up, we want a good, light, constant pull, and then we can build up into the strength. But I want you to notice that if this is the plane, it's slightly elevated about 5 degrees. So we're going to hold that. And we're going to hold that. Sometimes you might feel shakiness. Other times you don't really. So you're going to hold this for about 90 seconds. That's a good start. You should start feeling results pretty quickly, that you're feeling a little bit more lighter, or that you have a little bit more ability to turn and have more range. That's a great sign. We know this is working if that's going on. So obviously it's all about the small wins. You got to do this repetitively. This is a big, major injury. So you want to be able to do this for some period of time, 3 weeks, 4 weeks out. And this is going to be important. So same thing here. Our middle is now kind of more parallel to the ground. And I want to hold that for another 90 seconds. And if I get to lower, it's 5 degrees below the plane. So it's slightly down in this angle. So we're going to hold that. So once that's sturdy, some of you may want to advance this exercise, and that's where after you've done this, you go back to upper, middle, lower, and go 5 degrees out and continue to go 5 degrees. You can go continue to 5 degrees, 5 degrees, 5 degrees. Here, I just don't recommend throwing it that way. So you can just go out to about the sides, about 90 degrees both ways, and that should help, because sometimes we get hit, especially those of you who had whiplash from football injury. Now you got hit this way, guess what? I'm gonna need to strengthen it the opposite way. So I wanna be able to get those vectors stronger. So you wanna give that a shot. And that's gonna be the key to your success and building that stability. Like I said, you should be able to feel results, feeling better. Maybe there's less neck ache, less headache. Those are some great signs, but if you're getting more range and it feels lighter, that's overall a good sign. So hopefully you give this exercise a shot. And like I said, if you're gonna respond well, you're generally gonna respond well, and it's gonna get to those small wins, and you're gonna see improvement over time, things feeling lighter. And that's great, less neck ache, less headache. But there's a population of you out there who've had a little bit more serious of an injury, and I want you guys to heed my warning here, is that if you're feeling like symptoms in your tongue, or you're almost fainting, or it's just worse when you do this particular exercise, go to the emergency room, get it checked out again. Maybe you need an MRI or something like that. Or check with a healthcare professional or physical therapist that knows how to do it. I would not go to the chiropractor. I love some chiropractors, but I'm telling you, this is not that type of injury. You had something bad, you could have torn something. So get that checked out, heed my warning. But yeah, for the rest of you improving, we'd love to hear your feedback. Leave those comments below. And if you haven't subscribed to our channel, subscribe to our channel and leave these likes. I did this a little out of order, but I'm Dr. Lin. Remember, we heal smarter, not harder.